Hi, my name is Shaswati Nag, and I'm a recent graduate of Albany College of Pharmacy and Health Sciences. I'm a residency candidate for the 2023-2024 uh, residency year, and I'm interested in completing a PGY1 pharmacy residency at St. Peter's Hospital. Today, I'm going to be telling you a little bit about myself. Why do I wish to complete a residency? Well, there's a couple of major reasons. I wish to gain the tools that will allow me to practice at the top of my license. I wish to bring innovative contributions to the table that will have a positive impact on patient care. I wish to expand my career opportunities and become more learned in this field. And I wish to be optimally equipped to help patients achieve their short-term and long-term healthcare goals. Why do I wish to complete a residency at St. Peter's Hospital? Well, having worked at St. Peter's for a few months now, I can truly say that there is something magical about this hospital. St. Peter's Hospital offers an enriching and positive learning opportunity, and I wish to continue to work amongst compassionate and like-minded people who are making a difference for the Albany community every day. I also wish to be at an institution where I will be continuously challenged. And every day that I spend at St. Peter's Hospital, I can truly attest that I am continuously challenged. I am continuously presented with opportunities to learn and grow and become even stronger as a rising professional. And that really is one of the main things I'm looking for in a PGY1 residency. And that is something that St. Peter's Hospital truly does offer. What are some of my strengths? Well, I have a strong work ethic. I give every task, every challenge in front of me 150,000% every time. I'm highly dedicated, and it's really important to me that whatever I tackle, I complete and accomplish with my best foot forward. I'm also highly organized, which can be a good and a bad thing, especially in my personal life. But as an employee and as a professional, I think my organization skills are one of my top strengths. I'm highly organized when it comes to my workspace, how I manage my time, how I manage my schedule. And I really think that this will serve me well as a resident. I'm highly curious. I've always been highly curious, and I continue to be one as I pursue, as a rising professional in this field. I am always interested in learning more. I'm always interested in diving deep and understanding not just what, but why. And so I think, again, that will serve me well as a resident. I am also resilient and empathetic, and I think that this can truly be so valuable, especially when you're working with other healthcare professionals and patients. I think that being resilient and empathetic will allow me to make a greater difference as a co-resident, as an employee, and as a practitioner. Another area of my life where I feel like I've gotten a lot stronger, particularly in the past several months, is in maintaining a balanced lifestyle. Having been in pharmacy school, I think this is something that myself and a lot of other students put on the back burner. However, I have really found that this has been one of the most important tools in becoming healthier and stronger. I know that residency year can come with a lot of challenges. The schedule can be difficult. There isn't always a lot of time that you can devote to taking care of yourself. But I think having that foundation of establishing and maintaining a balanced lifestyle will really serve me well in allowing me to stay healthy and strong in my physical and mental health as residency year progresses. Opportunities for growth. Despite having worked at St. Peter's for a couple of months now, I still feel that there are so many areas I've yet to explore when it comes to the practice of pharmacy. And St. Peter's Hospital really offers so many opportunities for growth that align with the opportunities that I personally am looking for. I'm looking to really work on how I work through the pharmacist process, how I work on preparing and preparing medications for administration, educating colleagues, whether that be within our department or whether that colleague is in another department, interacting with patients and working on those skills when it comes to interviewing a patient, gathering information, understanding the verification process when it comes to applying those skills hands-on, and so much more. There's so many different areas that I have yet to explore, like I mentioned, and I really do think St. Peter's Hospital's program offers those opportunities for growth in a major way. My short-term and long-term goals, this is something that has not changed in the past year. Some of my short-term goals on a personal and professional level include living in a region where I can enjoy my off-duty hours comfortably and to the fullest. Professionally, I hope to obtain licensure, complete a PGY1 pharmacy residency, focus on my areas of interest, which include internal medicine, transitions of care, emergency medicine, and more, and hopefully pursuing a PGY2 residency position at the conclusion of the PGY1 residency year. My long-term goals on a personal level include establishing myself financially, being able to take care of my loved ones, and finding fulfillment in both my work and my personal achievements. As a professional, I hope to become a board-certified clinical pharmacist who is able to provide the best possible service to my patients, colleagues, and students as an educator. My favorite college course, as an undergraduate student, I took this class called The History of Marriage. And this was such an interesting class. It still stands out in my mind today as one of the most interesting classes I took as an undergraduate student. It was so interesting to sit around the table and talk to people who had different upbringings than me, different cultural backgrounds than me, different philosophies and morals than me, and really understanding the history behind this institution that obviously is challenging, but I think is really valuable and really something that we take for granted maybe in society today. And I really think that understanding that history has really given me so many a perspective that has served me even today, despite having not taken the course for so many years now. One of my favorite books growing up as an adolescent was The Giver. I've read several books since reading The Giver. However, this still stands out as one of the books that had a huge impact on me growing up. Since I've read this book in my young adult years, there's been a lot of criticism and controversies that have arisen in our society today. When you look at the commentary on this book. However, in my mind, still, it stands out as one of the first times I realized all at once how enchanting and how horrifying the product of someone's imagination can be. And I think this is a really good metaphor for how real life is, right? Things can be both enchanting and horrifying all at once, and we need to learn how to exist in that dichotomy. And so this book was so interesting, and it still stands out, like I said, as one of my favorite books growing up. My greatest non-pharmacy accomplishment definitely has to be overcoming the challenges that came with being born with a condition known as cystic hygroma or lymphatic malformation. Throughout my childhood, I had 30+ surgeries to treat this condition. And today I still look different than most other people. However, I am proud that I never allowed this medical condition or this aspect of my life to interfere with accomplishing my goals. I'm truly grateful to my parents for the kindness and the grace and the dedication with which they've raised me and helped me deal with the challenges that came with having this medical condition. And I can truly say, at this point, I would not have changed a single thing. I'm glad that I went through what I went through, and I think it's helped me become really resilient. And finally, what brings me joy every day? I love spending time with my family and my friends. I love watching a great show or documentary. Storytelling is one of my favorite things. I love watching and listening to other people's stories, and exercise and spending time outdoors. I love being outdoors, especially as I get older. I always look forward to that time in my day when I can go outside, get some fresh air, take a walk, and exercise has been such an important tool for me in my personal growth. And so that is definitely something that brings me joy every day. Thank you so much for listening today. I hope you learned a little bit about me, and I look forward to learning more about you as I continue in this interview process. Thank you so much.